So firstly, just on behalf of the National Tribal Women's Forum, we'd just like to thank Claire Haven for giving us the opportunity to speak here today. And also, for those that don't know me, I'm Bridget Kelly. I'm a community development worker with the National Tribal Women's Forum. And the National Tribal Women's Forum itself is a national network of tribal women's organisations. So today I'm going to speak to you about the membership of the tribal community, but also talk about some of the challenges, the barriers, fears for tribal women who experience domestic violence and also in accessing domestic violence services. So we would all know that women from every ethnic and cultural and social background can and do experience domestic violence. However, women from minority ethnic groups, including tribal women, can be placed further at risk due to intersection of gender and ethnic discrimination and the resultant of poverty, socialisation and disadvantage are structural inequalities faced by tribal and other minority ethnic women, which compounds their difficulties in seeking help, support, protection and long-term options when dealing in a violent relationship. Tribal women face multiple forms of discrimination and disadvantage and are more likely to be unemployed and have a low income and become dependent on social welfare payments. Tribal women then are often financially dependent on their spouse and partner's income, and this dependency then can make it very difficult for tribal women to leave a violent relationship. For many tribal women, they would not have access to money, a car, and even in some circumstances, not even access to a mobile phone. And factors like these have proven to be considerable obstacles to accessing services. Limited access to financial resources is a factor for many women. However, as the economic base in the tribal community is linked to extended family networks, there's a further pressure on tribal women to keep the family together, pressure which may force a woman to stay within a violent relationship. So, you know, there is an urgent need to address the structural inequalities of discrimination and the resultant of poverty, which places tribal women at further risk of domestic violence. Domestic violence and sexual violence are often hidden crimes, and much goes unreported. And this is true for the majority of the settled population. However, for tribal women, as well as for other minority ethnic groups, there are additional barriers to disclosure and seeking support. For example, discrimination, the actual and the feared, is a major barrier for tribal women seeking protection. It has resulted in a mistrust and reluctance to disclose and seek support from authorities, services, including Gardaí and health, social worker and special gender-based violence services. Tribal women have reported that they may be reluctant to seek protection of the Gardaí, as the fear that reporting will result in a discriminatory attitudes and treatment, including a particular harsh treatment of their husbands, and furthermore a fear of negative reaction from their own because of the level of distrust of the Gardaí that still exists within the tribal community. And there's also fears that reporting abuse will further stigmatise their community, resulting in a reinforcement of negative prejudice and discriminatory attitudes that the tribal community is endemically violent, widely perpetrated by media reports. Tribal women will often choose to protect their community against further racist stereotyping by remaining silent about their own experiences. For tribal women, in accessing domestic services include lower levels of literacy and language barriers, and furthermore, there's a lack of awareness of the range of services available and how to access them. Tribal women traditionally have accessed local refuges for respite and support and have built up trust in these services. However, they are often not aware of the helplines, outreach and counselling and local domestic services. Tribal women also fear that disclosing and seeking support from social workers and social and service providers will result in their children being taken into care. And again, this can leave tribal women staying in violent relationships. Another important issue is accommodation, access and accommodation for tribal women who experience domestic violence. But for tribal women, predominantly seek the support and safety of refugees when trying to deal with a violent relationship. Increasingly, tribal women are being refused access to, as funding cuts have resulted in severe shortage of places and are therefore forced to return with their children to a violent situation. The failure of the state to adequately provide tribal accommodation severely impacts on tribal women's options in leaving a violent relationship. Although services are working to become more inclusive minority ethnic groups, and in particular traveller women, barriers to equality of access and outcome remain. There's a need for cultural awareness and anti-racism training and the development of inclusive policies and practice. And we are aware of traveller organisations that, does provide this anti-racism and cultural awareness training, and they do this through mainstream and domestic services. And we feel that this helps to inform the development of best practice in working with traveller women. Another point I'd like to make is that there is a need for traveller women's representation in management and travel staff needed within, domestic violence services, because sometimes for traveller women disclosing their experience of domestic violence to a settled person, and that's no disrespect to any settled person, but there is fears there, but disclosing their domestic violence situation to a settled person can be difficult for some travellers, as they feel that there's a lack of understanding around traveller culture, and that the settled worker could sometimes be prejudgmental against them. And best practice would be for maybe to have a traveller woman as an option, a traveller woman or a traveller support worker available to complement the key worker of the organisation. And it's also important, that we will be advocating as well that it's important to have or implement an ethnic identifier as well to collect data which includes, for traveller and Roma ethnicity, in order to further develop the further development of inclusive policies and services. Also, there is a need for more engagement between traveller organisations, community groups and women's groups, and services and domestic violence services. And as we feel, this helps to build engagement and build better relationships. And it's good practice to make these connections. And linking in with organisations and community groups, as I said, is a good way of building relationships. And I suppose we just wanted to say as well that the National Travel Women's Forum have been in contact as well with the Primary Healthcare Project here in Ennis, and we've been speaking to the coordinator, Breed, and they are quite open in linking in with the services here locally in Clare. And there was even a suggestion of maybe having an open day where they could actually invite services along. So again, this is a good way of building good relationships. So what I'm going to do now is I'm just going to hand you over to my colleague, Bridget Casey, and she's going to just talk a bit about her role and her role here in Clare. So I'll hand it over to Bridget now. Thanks very much for listening.
You're on. Again, just say thanks to Clare Haven inviting us here today, which is a very, very important event. I'm not going to go over and cover what Bridget said, because Bridget have highlighted all the issues in relation to what we face within the travel community. I'm just going to explain a little bit about our organisation, our Clare Travel CDP. As I've said previously a while ago, I have just been appointed maybe 3 months now as a coordinator of this organisation. There have never been a travel organisation in Clare. There was previously a CDP project, but it wasn't specific on traveller issues. It was more broader in regard to people disadvantaged, migrant and so forth. There was a study carried out in 2009 with the THU and the primary healthcare in regard to health needs analysis in the travel population in Clare. And following from the study, it was recommended the primary healthcare would be set up again. The primary healthcare was running for a number of years in Clare, but unfortunately it won't. And then now it's set up and running. And from the assessment of need, the health need was carried out, it identified and showed that there was really a need for an independent traveller organisation in Clare to support the travel community on the ground. We're funded by the Department of Rural and Community Development. At the moment, we have a steering group in place, which is made up of the Clare Local Development Company, Clare Public Participation Network, Clare Women's Network, and the HSE Traveller Health Unit Midwest. So that's a steering group is set up in place, kind of directing me in my work and so forth. But we're hoping to set up an independent organisation down the road. This is a pilot project to fund them for 3 years that we got from the department. So we have to prove and demonstrate that we can run an organisation and that it can be travel-led in Clare. I work very closely with the primary healthcare women in Clare. They're fantastic women. They're, you know, we meet on a regular basis, and they be out on sites and relationship into houses and so on forth, and delivering information and so on forth. I know yourself, Siobhan, have been the previous coordinator there, and like we would like an opportunity if we could meet Clare Haven, myself and the primary healthcare and other organisations here, that we could share knowledge and experience and so on forth, and work in a partnership to better outcomes, not only for the travel room but across the board. Yeah, so thank you.
I suppose just to emphasise the points that Bridgie has made as well, you know, and what we've been saying, that, you know, would be good. It is a good way of making connections, and I think what the Primary Healthcare Project have said, that they're open to have an open day, and if people would like to come along, any service within Clare, I think it would be a good opportunity of building bridges, and also building better relationships, and working together collaboratively and getting better outcomes for the community. So that's leave from us, and thank you very much, and thanks for listening. If you have any questions.
And just to highlight, we're hoping to run culturally appropriate training maybe in the next couple of weeks, and if people like to get involved in it, we as an organisation would be hosting it, but our colleagues in Cork TVG will be running the training. So if people want to participate, I will let you know in time regarding that.